Welcome to today's press briefing. We have with us the head of the Communicable Disease Branch of the CHP, Dr. Chang Shok-Kwan, and Chief Manager of the HA, Dr. Sarah Ho. We'll first hear from Dr. Chang. Good afternoon. From our public lab, together with the Housing Authority, we have confirmed altogether 3,629 cases. Of that, 2,294 of them were confirmed by our public lab, and 1,335 cases were confirmed by the HA without having to double check. Of the 2,294 cases, that is, tested positive by the CHP, 52 of them carry L542R variant, that is, suspected Delta. 2,136 cases don't have L542R, that is, suspected Omicron. 106 cases are currently unconfirmed because they have not been processed or the sample is insufficient. We have 7,600 cases that is preliminary positive. We have a backlog of 4,800 samples that are undergoing testing. We hope to get the results this evening. It seems that there is a difference between the confirmed cases and preliminary positive cases. It may be because private laboratories have yet to send these samples to our laboratory. We ask them to send them as soon as possible for verification. Of the 3,629 cases, 2 of them are imported cases. 3,627 cases are local cases. We have received cases about 30 residential care homes, of which the residents or the staff members have been confirmed to have contracted the virus. So far, there are about 150 care homes with residents or staff members that are confirmed positive. That's all for my report today. We'll hear from Dr. Ho. Good afternoon. So far, 3,099 confirmed and preliminary positive cases, patients that are staying in public hospitals, the North Lantau Hospital, Hong Kong Infection Control Center, the Infectious Disease Center of the HA, and the community treatment facilities at AWE. We have close to 2,200 patients that are staying at the Penny's Bay Quarantine Isolation Center. There are about 10 or so patients that are in a critical condition. So far, that is, as at midnight in the previous 24 hours, 10 patients who have been confirmed have passed away. 8 of them have been mentioned in the press release last night, and 251 patients have recovered and been discharged. So the utilization rates of isolation beds of public hospitals have reached close to 90%, which is the ceiling of our capacity, the limit of our capacity. Over the past few days, you've seen makeshift tents outside a number of A&E departments for patients who are waiting to be admitted. Starting from today, we have vacated some indoor venues for converting into patients' waiting area. That includes outpatient clinic waiting area, corridors, staff areas. We've also made arrangements for outdoor areas outside hospitals to be converted into patient waiting area. The work is daunting because there is limited space outside the hospital. We're also concerned that patients that are waiting outside will not be well taken care of, especially in the past few days when it was cold and wet. We're concerned about their health conditions. We do our best to arrange all patients to move to an indoor area within today. For patients who are in a stable condition, we've moved them from hospital to the infection control center of the North Lantau Hospital, as well as the community treatment facilities at AWE, as well as the community isolation facilities at Penny's Bay. We hope that this will release more beds for those in need. There are A&E departments in the Kowloon area that are still suffering huge pressure. The number of people seeking assistance at the A&E department is still numerous. Well, a large number of patients were waiting outside at the A&E. After the backlog have been cleared, ambulances continue to send a lot of patients to A&Es. Most of them are residents from care homes, and these patients are mostly quite frail. We will do our best to take care of them. The waiting time for A&E service is quite long. We ask for your understanding. Hospitals will arrange for those who have recovered and those who are of a better health condition, that is, elderly patients, to go back to their care homes. We ask care home operators to take them back. We ask them to work together with us so that beds at hospitals can be released for the use of patients in a more serious condition. We also have strengthened our work of our outreach team to support patients staying at care homes. This is to give assurance for care home operators to receive residents and take them back from the hospital. We are gradually reducing our non-essential services, including specialist outpatient clinic as well as scheduled operations. The extent of the reduction has reached 50%. We want to release staff manpower to the front line. We're also exploring different avenues to increase community isolation facilities. We will dovetail the government's work by providing them with medical support. As soon as these isolation facilities are commissioned, we will send our assistants there for these facilities to receive patients who are under isolation. We ask people not to send resources to hospitals or to the hospital authority. We have sufficient resources, including warm clothes as well as other supplies. We have stock for 6 months. So we ask these kind-hearted people not to continue to send resources to the hospital because they may inadvertently affect the work of healthcare. We are not short of resources. We are short of manpower. We ask healthcare workers from the private sector and from different areas to come to help us. Once again, I thank you all for your care towards the HA and our patients. Please use other ways to support the healthcare worker. We have 150 staff members of healthcare workers who are confirmed cases. They contracted the virus from a domestic or community setting. There are about 8 patients who were confirmed positive from the admission screening. About 20 patients in the same cubicle are close contacts and will be isolated.
Q&A session now. Please state your name and organization before you speak. RTV. Just now, you announced the names and ages and gender of the 10 deceased, and you also said that the hospital authority would like to move outdoor patients indoor as much as possible. But then you also said that the corridors are also crowded. Would there be compartments along the corridors? Otherwise, there will be more risk for healthcare workers. And you also mentioned that other indoor venues will be identified. Can you share with us which venues you are considering? Yesterday, it was announced that in Kowloon Hospital, 20 patients contracted the virus. What are the details? Is this a large outbreak? Thank you. Today, as said just now, as of 12 midnight last night, in the past 24 hours, 10 contracted patients or infected patients passed away. For 8 of them, the details were announced. And for 2 of them, one is 62-year-old male, and there is one who is 96-year-old female patient. Both of them have chronic illnesses. We can see that the weather is getting cold. So for patients who are waiting outdoor to be hospitalized, this is not an ideal situation. So that's why we are trying our best to identify indoor facilities so that these patients can be moved indoor. Now, when we move patients indoor, we have to also consider ventilation and also people flow. But then we have to strike a balance between the two sides in order to guard against risk. We know that the government is trying to find different facilities so that we will be able to make sure that patients can wait for hospitalization indoor. Further details will be announced by the government. As regards Kowloon Hospital, we do not have information right now. Next, please. The one with a white cap. I'm from commercial radio. Just now, you said that right now there are many elders who are in the hospital from elderly care homes, and you hope the elderly care homes can take back the stable elders. So will there be some protective gears for workers working in these elderly care homes? In Penny's Bay, some mild condition patients said that they have waited a long time, but still there is nobody taking tests for them. So are there enough manpower? Is there any bottleneck in Penny's Bay? Will that affect also the flow around the quarantine or isolation facilities? Thank you. We have to thank the elderly care homes for taking back stable cases. We will send outreach teams to enhance communication to see what their problems are. We want to make sure that support can be given to them so that they can take care of residents. We know that SWD is communicating with them because SWD is the regulating body, and they have issued guidelines. And as far as I know, some personal protective equipment and supplies are being given to these care homes. As regards Penny's Bay facility, we are responsible for the medical system. As regards the disbursement of test kits or the administration of tests, we will contact the contractors. We will let them know that the arrangement needs to be improved. Next, please. The one at the back, TVB. I want to follow up on quarantine hotel arrangements. So this arrangement is in place today, but still patients are not sent there yet. So they are mainly for patients who are in mild condition and those without symptoms. Which patients will have priority? Will they be those in AWE or those which have milder conditions? And then have you contacted private hospitals so that those have mild condition or those without symptoms can be sent there? There is a case, 90-odd-year-old lady. So when she was sent to AWE, she had a fever, and then she was sent to North Lantau, but then she was not admitted. And right now, she has been staying outdoor for a few days, and she's not able to take care of herself. And family members are of the view that you are torturing her. And then she is not hospitalized. If there's anything happening, which government department would be responsible, and what will be done? And how many people died because of lack of treatment at A&E? And there are news that there should be in situ tests in elderly care homes, but then there is lack of manpower. Environment is not satisfactory. There are many big rooms in care homes where many elders are living together, and there are insufficient supporting facilities. So will there be the chance of bigger outbreak at elderly care homes? Thank you. For the community quarantine or isolation facilities, they are mainly for patients with isolation need. Just now, we have received the addresses of hotels, and we are making the arrangement. We will identify suitable patients from our system to be moved to the community isolation facility. Regarding private hospitals, we are in contact with them to see in which ways they can help public hospitals and what role they can play in the overall anti-epidemic work. Now, they may not take in confirmed patients. However, on other areas like injection, we will see whether there are other methods or formats where they can also help. Regarding those patients waiting at A&E departments, we have said to our colleagues that when it comes to elders and young children or needy patients, we have to do more inspection and checks. Next. Right now, we have already stepped up inspection and checks, and according to our records, we are gradually arranging hospitalization of the patients. Next, cable TV. I want to ask about the cases. Some audiences told us that in Kwai Fook Road in Kowloon Bay on a construction site, there are more than 100 cases, confirmed cases. So is it true that there is such a big outbreak there? Has that construction site suspended work? If not, are you going to do a check and ask the contractor to suspend work? Then regarding healthcare availability of wards and also manpower, as such as now, there is a severe lack of manpower, and today Dr. Sylvia Chan also sent a letter saying that some private hospitals declined admission of some patients with symptoms because they are worried of infection or outbreak. So do you have any information on how many patients were declined admission by the private hospitals? Given this very serious situation, you said that you will communicate with private hospitals to see how they can help. Actually, can you be more specific on how private hospitals can help? Will it be an option that they can also lend some hospital beds? Will Hospital Authority make that request? Some private doctors said they would like to join in the anti-epidemic work, even though they would like to join, but they don't know what they can do. So we hope Hospital Authority can strengthen coordination and let them know what tasks they can take up. So with private doctors' applications, will you take into consideration their views? Will they be allowed to choose the type of work that they can do so that that will facilitate more application? And just now, you made an appeal saying that people don't need to donate more supplies or materials to hospitals. Why did you make such a point? Is it true that there are too many materials or supplies? Are you trying to reject other people's gestures of goodwill? What will you do with the materials or supplies you have received? For Kai Tak, I think there are many construction sites. That is a large area. Some time ago, there were some scattered cases. So some people lived in the housing estates and then brought the virus to the construction sites. We need to examine further to see the situation.
We are in close communication with private hospitals. We ask them to support us in different ways. That includes asking doctors in the private sector to take up locum or part-time work for us. we have a locum part-time office to deal with all these applications. We have streamlined the application procedure. You can send your application by WhatsApp and someone will contact you. We hope that by streamlining the procedure, everything can be done more swiftly. If an application is made in the morning, we are able to make arrangements for the part-time work to start in the afternoon. Once again, I thank different stratum of society for their support. So far, we have sufficient supplies. There is a huge volume of people at A&E departments. At the moment, we do not need resources or supplies. If you would like to support us, you can support us in other ways so that we can reduce the amount of people at the A&E department. We want to do better in terms of infection control. Sorry, speakers off mic. The speaker is not using a microphone. The interpreter cannot hear. I don't have the data with me. We streamline the procedure by allowing applications to be made by WhatsApp. We'll see what other ways we can do to make improvements.
The SCMP, first two questions for Dr. Ho, last one for Dr. Chuang. Does the HA have the latest figure of how many people are waiting outside all the public hospitals? And does the authority have enough time to move all outdoor patients indoors within the next few hours before the temperature drops? Or should we still expect to see patients waiting outdoors tomorrow? Where will these patients be moved to? And can you provide the figure on how many people are in a serious condition, their age range, and vaccination status? And can the HA provide the latest figure of how many COVID patients were admitted to the A&E wards? And for Dr. Chuang, how many foreign domestic helpers have tested positive so far? What should employers do if their foreign domestic helper tests positive? As NGOs have said, at least 10 helpers who tested positive have nowhere to go after their employer kicked them out of their homes. Thanks.
Or maybe I'll answer the foreign domestic helper first. I understand quite a lot of foreign domestic helpers as part of the family clusters. They are confirmed, but I have no exact figure on how many of them.
At the moment, or as at yesterday 6 p.m., and I have total 75 patients are in serious conditions. I don't have the age breakdown. And also, we'll try our best to mobilize all internal area, including some staff area, corridor, some general outpatient clinic area, to move or to arrange those waiting outside the A&E pending for admissions patients to move to the indoor area. So this is our target to have it done by tonight. We'll try our best to do it as far as possible.
Dr. Chuang, what should employers do if their foreign domestic helpers have positive?
I have no answer to that because they should be wait for isolation facilities.
下一題問多條英文問題啊，嗰邊嗰位。
Another English question.
Hi, TMHK. So will the hospital authority provide support for elderly care homes to help them take back in some of the discharged patients? And secondly, some experts proposed that private hospitals could also play a part in taking in some COVID patients to ease the burden on public hospitals. Is that feasible? Will the HA or the CHP do something about it? Thank you.
I'm sorry, will you please repeat the first questions? Do you mean how we support the RCHE discharge RCHE residents?
Yes. What kind of support can you give to the elderly care homes?
Thank you. Sorry for that. And actually, we have our outreach team, that is the CGET team, will try to visit and support the discharged OH home residents. And at the same time, we understand most of these patients have underlying chronic disease. And now we also understand or liaise with the worker in there, what are their problems, and how can we support them. We'll continue support over the coming 2 days, even on Saturday and Sunday. For the private hospital, we have regular communication with them to see which area they can provide support in the COVID. At the moment, it's still under negotiation.
CHP will provide segregation advice for the infection control advice for the RCHEs on how to segregate the cases and the close contacts and the non-contacts.
下一題，前邊嗰位。
你好，01嗰邊嘅。
I'm from Hong Kong 01. I have questions for the hospital authority. Do you have figures of the number of people waiting outside hospitals? You said that you're trying to move them indoors. Can you guarantee that it can be done today? You mentioned about indoor areas. What are they? Regarding cooperation with private doctors and private hospitals, a number of people expressed concerns about liability. Would you approach them to explain to them clearly? Well, we know that in the coming few days it will continue to get colder. No one wants to see elderly people suffering from the cold outside hospitals, waiting to be admitted. So we explore every avenue possible to move elderly people waiting outside indoors. That's something that we really want to do. We endeavor to do, and we would leave no stone unturned to get it done. In relation to other areas outside hospitals, we're aware that the FHB is helping. They're trying to identify other areas. As soon as they find somewhere, they will notify us. That is the first and foremost thing we all want to do. In relation to private doctors, there is a part-time office dealing with applications. We have a dedicated team answering their questions. We will do whatever we all can to help. Previously, there was a hotline. The first tier are manned by nurses and allied health professionals. The team will answer questions in relation to infections. If there is a further medical need required, at the first tier, these requests will be jotted down, and we make use of patient support call center to answer these questions. The private doctors can help at the call center to answer these questions. Next question, the reporter in the middle. I'm from Hong Kong Economic Times. I'd like to ask first, Dr. Chuang. 86 staff members at the Xiangshui abattoir have been confirmed to have contracted COVID. So the abattoir has been closed and the work has stopped. We'd like to ask for details and the reason why there is an outbreak. For the hospital authority, you said that there is the latest guideline given to care homes. They were asked to keep elderly people who are in a stable condition in the care home for isolation. But the condition may not be ideal, and even when the elderly patients are in a stable condition, there is always a chance that the condition may deteriorate rapidly. And then they would be in a dilemma. We've also heard from some doctors that they have applied to work part-time. However, it takes a very long time. They may have to wait for 1 month. You talk about a WhatsApp application. Starting from when this approach was adopted? Can it be achieved that you make an application in the morning and in the afternoon you can start work?
That's all from me. Thank you. We do know, and the FEHD has told us, that in Shangshui Slaughterhouse, there are around 80 workers. Well, actually, there are altogether more than 1,000 employees there. But then, some regular checks will not be able to be done. But then we have given them some means to do cleansing and closure and so on. And then, of course, the cases, the confirmed cases and their close contacts have to stay at home. For elders living in care homes, I do understand that staff members in elderly care homes face their own difficulties as well. Everybody has his or her difficulty. However, please put back the right focus on the elders. We hope that the elders can remain safe and healthy. With this focus in mind, then we have to look at how we can tackle the problem. So if the patients are in stable condition, and if they can move back to the care homes, we will send outreach teams to support them to see what their needs are. So let's join hands and work together and solve the problems together. Regarding the part-time office and the WhatsApp arrangement, well, it is just a new measure. We have heard feedback about application. Some suggestions were given to us, and now people use a lot more of mobile messages. So this is a new arrangement. We do have experience that there is a case where application was made in the morning, and in the afternoon, the application was processed already. For other cases, we are now examining the situation. If there is room for further enhancement, we will definitely improve. Next, the one at the back, please. I'm from Mingpao. I want to ask a question about cases today. Yesterday, there were 6,300 preliminary positive cases. Today, there are 3,600 odd confirmed cases. Is it because there is a bottleneck that you cannot catch up with the tests, and so there is a discrepancy between the results? And what about waiting at home for isolation arrangement? There are people who have waited at home for 14 days and then they can take a test to see whether the results are negative. I want to ask the Department of Health, what kind of tests should these people do? Antigen tests, deep throat saliva, or swab test? Some patients said that they have waited at home for 14 days and they wanted to do a test in community testing center. Is this feasible? If they want to go outside for a test, are there anti-infection measures from the D.H. for these people? And for Department of Health and HA, do you know how many people have waited at home for more than 14 days? So how much can you shorten the queue for hospitalization for this measure? And then for relaxation of isolation, well, for those who have waited at home for 7 days after isolation, what tests do they need to do after that? And does HA know how many people have already been isolated for 7 days and then they have negative antigen test results? How many of them altogether? Have you expedited the process? And then finally, elderly care homes. HA said yesterday that some care homes were not willing to take back the elders. So are those infected elders or recovered elders or those who have other illnesses? Now, some residents have positive rapid test results, and the care homes are not willing to take them back because they are worried of possible outbreak. Now, for these elders, if their rapid test results are positive, how come they cannot be hospitalized? And some care homes said that their environment may not be suitable for isolation. So if they take back the elders, there may be outbreak. Apart from outreach team, what kind of anti-infection measures can be provided? to these care homes by the Department of Health and HA. In terms of figures or numbers, well, yesterday there were 3,659 confirmed cases, and for public health laboratories, right now or yesterday, there were 4,800 samples received yesterday together with the backlog. And this morning, there were 7,600 preliminary positive cases. And then there are a lot of these cases where private laboratories have still not sent the samples to us. Of course, there is still backlog in our laboratories, but then the number is not big. And there are many private laboratories outside which have failed to send us the samples yet. And so perhaps the laboratories are already overburdened. So they are trying their best to catch up. We have made an appeal for them to send us the samples as soon as possible. As far as I know, for the 14-day test, well, antigen test will be good enough. And according to scientific literature, after infected or after a positive test result, then in the first week, virus load will come down very quickly. And after 2 weeks, the situation is quite safe already. The WHO said 10 days. So after 10 days, people can leave isolation. But we want to play safe, so that's why we say 14 days. So after 14 days, an antigen test should be done. But for some individuals, even after 14 days, they still are worried. So they want to do a test in community testing center to get a negative report. Of course, that is fine. So concerning amendment to the isolation criteria, we believe that the number of days of hospitalization can decrease. And some time ago, the median duration of hospitalization is 10 odd days, and now the latest median is 11 days. When the criteria and conditions are revised, we believe that the turnover can be faster, and so some more beds can be vacated to take in more patients. And previously, we talked about elderly care homes. Well, the size, the type of patients admitted, the format are all different, so it is difficult to generalize. However, overall speaking, our common goal is to take good care of the elders. So for those patients with stable condition who are suitable to be discharged, we send outreach teams to support them. We work together with them. So we hope to allay some worries. At the same time, we know that SWD also has some enhanced guidelines and protective gear to support them. There are also allowances to help them. So there are different measures hoping to help these people. So this is the end of the press briefing. Thank you very much. So right now there are 8,566 people which are in home quarantine.